everybody. Dr. Suzanne Yee is here to tell us a little bit more about not liposuction, liposelection, especially when it comes to the underarm area. Good to have you, Dr. Yee.
Thank you for having me here.
What's the difference in liposuction and liposelection?
It uses ultrasound to heat the skin. And many women have a common problem with that shaky underarm, and they're self-conscious about wearing short sleeves or going to the swimming pool because of that shaky fat on their arms. So now we're combining a protocol where we combine Thermage,
which we've talked about before, but tell us what that is.
Thermage is a radio frequency device that delivers heat to the skin on the outside. And we have a newer device which has a larger head, and it gives bulk heating to the outside of the skin, and it will help with skin contraction, and so we're delivering heat to the outside, and then afterwards we make a couple of small incisions and put some numbing medicine in, and then we apply the Vaser LipoSelection. It's a small probe much like this. It has heat that comes out of the end, and so then we're delivering heat to the inside of the skin. So the skin is getting heat from the outside and also from the inside and causing more skin contraction. Because when people have just regular liposuction, you're always worried about that sagging skin.
Right, yeah.
And so this way, we're heating the skin, tightening the skin, and then removing the fat. And we get smaller arms, more toned skin, tighter skin to give you a more shapely, toned, smaller arm.
Okay. I think we have a little bit of video right there just to kind of show how small the incision is, right? Yeah. So it's very small, but you make a couple of incisions?
One incision at the top and one incision at the bottom. And then after we do that, we place the Vaser cannula underneath the skin to give heat to the skin. And then we suction the fat.
Yeah, and you guys wanted to show this because you said it's really not that big of a deal as far as the incision that goes in there.
It's not. It's a minimal incision, and also there's minimal downtime with this. So we'll have the patient come in and do Thermage either up to 1 week or even the day of the procedure in the clinic, awake, and then we take them to the procedure room, we give them a little numbing medicine, and then we do the Vaser procedure. So you can do everything while you're awake.
You're awake through all of it.
You can be awake through all of it. Then we wrap the arms with some elastic bandages. You may have some drainage that day. We have the patients come back in a couple of days, or the next day.
You get to wear this lovely...
Yes, wear this garment, but you can wear it under your clothes, and it gives compression to the arms and helps with more skin tightening of the arms and shaping the arms.
How long would you wear that then?
Between 4 to 6 weeks, but patients can take it off and take breaks from it. But it's most important for the first 2 weeks.
Okay, because you want to compress that area.
Right, compress that area.
Well, I think we've got some before and after pictures to show you as well. And, it just seems like at a certain age, suddenly our arms start looking flabby
and
like this.
And these are for patients that have moderately excessive skin and fat. So you see this lady, she's actually in her 60s, and she had a great result. And this is a person that has excess skin and fat at the underarms. You can see how much retraction she got with decrease in the size of her arms.
Yeah.
And then we have another patient, the same thing. And so they get great results with minimal downtime. We worry less about the skin just sagging after the liposuction because we're able to get some skin contraction from the Thermage and the Vaser.
So you're combining two procedures that you've really found success with both of them.
Yes, that's a new protocol that we're using together to help with that area. And we're also doing it for the subminimum or the chin area too. So that's been very nice.
Okay, if you want to check into that, you can do that as well. How long do they need to be off work for a while, or when are they back to their normal activities?
Well, what's really nice is you just take 2 to 3 days from work.
Okay.
So if you do it on Thursday, by Monday you can go back to work. And then you can go back to your normal exercise routine in 2 weeks.
How about that? Okay, well, we want to remind everybody about Cosmetic and Laser Surgery Center, of course, over on Highway 10, and the website is a great way to kind of familiarize yourself with all the procedures you have.
Yes.
And all the services there. Oh, you've got a holiday open house.
Yes, we have our annual holiday open house. It's November the 7th, and we benefit the food bank as always. So we have large barrels for food to donate to the food bank, and we have catered foods, and we have hourly door prizes.
Oh, good.
And just a lot of fun.
Yeah.
It's just a lot of fun. It's
just a fun, relaxed way to come in.
Yes, just come in. We're just there to visit with everyone.
And if you have any questions about any of the services, is that the one that Danny Joe did?
Yes, we have live demonstrations. We'll have live cool sculpting that day. We'll have live injections. It's just it's a lot of fun.
Very good. Some people may be saying, I'll volunteer for that. Well, that is coming up November 7th. Thank you, Dr. Yee. We appreciate you. All right, that can just